Hi, my name is Kiera Waters, and in this video, I'm going to be demonstrating how I would perform trach suctioning. So the first thing I would do is just to verify my physician's orders, making sure I have the right order and to do trach suctioning as well as the right patient. After that, I would gather up my supplies, which now I have my trach suctioning kit as well as my sterile saline. For video purposes, this is going to be sterile saline, and it's going to be a new bottle. With the new bottle, I would just document, I would label on my bottle the date and the time it was opened. If it was a used bottle, I would, once I go in my patient's room and set up everything, and then I would just lips the used bottle and then pour it into the cup. But for video purposes, this will just be a new bottle. So once I've gathered all my equipment, I'm going to go into my patient's room and identify myself and just let my patient know what I am here to do. And then I would explain to them the procedure as well as just identifying my patient with name and date of birth. And I would check against the armband as well as with the MAR. And then I'm going to go ahead and wash my hands. And once I have finished washing my hands, I'm going to make sure my patient is in the correct position, either semi-Fowlers to Fowlers. And then I am going to make sure my suctioning is equipment is all there, and I'm going to turn on my suctioning to the appropriate setting and making sure the tubing is close to the patient on the bed. After that, I am going to go ahead and wash my hands. And then I am going to don on my PPE with my gown, my mask, and my face shield. Once I have done that, I am now ready to open up my kit. So go ahead and open my kit. And then making sure I touch just the outside, I would grab my cup and set that to the side. I would take my sterile saline, open that, and just pour some of that inside my cup. Okay. And once that is done, I'm just going to set that to the side. And now I am ready to open up, making sure I just touch my 1-inch quarter. And I'm going to go ahead and grab my sterile gloves. Okay. Starting with my dominant hand. Okay. All right. Once my gloves have been put on, we're just going to discard this, slide it to the side. And next, I am going to grab my catheter. Okay. Once that, I'm going to take my catheter with my non-dominant hand. I'm going to grab my suction and I'm just going to connect. Once that has been connected, take my tubing and making sure that my thumb is not on the tubing, we are going to moisten the catheter into saline. Just suctioning. once that has been moistened, then I am going to go ahead, grab my tubing, and I am going to hyperoxygenate my patient with my non-dominant hand, either with a resuscitation bag or a face mask, and allow my patient to do some deep breaths. Once my patient has been hyperoxygenated, I'm going to set it close to the side, and then I am going to grab my suction. And with my catheter, we are going to advance it about 4 to 5 inches inside the trach, or until I meet resistance or my patient starts coughing. Making sure that my catheter is not touching my forearm, as well as my hand is not touching the trach. So once I have reached that point, then I am going to start rotating and suctioning intermittently until my catheter is out, making sure that I do no more than 10 seconds. Once that first pass is done, I'm going to have my patient just to cough as well as deep breathe. And then I am going to reassess my patient. So I would just go ahead and listen to my patient once again and see if there's still any adventitious sounds, or see if my patient still has some secretions. And if I see that my patient still needs just a little more suction, I would do one more pass. And so what I would do is I am going to take my catheter and moisten it again, dip it into my solution. Once that's done, I am going to go ahead and replace my oxygen onto my patient once again. And then after that, I am going to allow my patient just to rest for at least 1 minute between suctioning. And once my patient has rested for at least a minute, then I'm going to go in and complete one more pass into my patient. So I have 4 to 5 inches, so I meet resistance when my patient starts to cough. And then I'm going to, in a rotating motion, intermittently suction no more than 10 seconds. After I have done that, I'm going to have my patient just to cough, as well as deep breathe again. And then I am going to turn off my suctioning. I am going to replace my oxygen as ordered. And then I am just going to discard my supplies as well as my gloves. So once everything has been discarded, I'm going to wash my hands once again. And then I'm going to auscultate and listen to my patient's lung sounds once again. And then after I've listened to my patient's lung sounds, I am going to document into the chart the procedure, as well as observations, including the characteristics of the secretions, as well as the characteristic of the respirations before and after suctioning.